Hi, my name is Justin Brochetti from Intelligence Factory, and with our software FairPath, a lot of people ask me where the AI technology lives. And at its core, FairPath has a underlying infrastructure of AI living throughout its DNA. One specific example of this is whenever we ingest patient demographics into FairPath, when we import those patient demographics, we actually have an ontology-guided augmented retrieval system that can take the clinical notes associated with a specific patient and map those clinical notes to corresponding ICD-10 codes, thereby automating the clinical note summary to ICD-10 code coding process. So what you'll see here is in the patient eligibility and onboarding tab, you have eligible conditions for specific patient care programs like RPM, CCM, and APCM. In order to classify whether or not a patient actually qualifies for these programs, we first have to find the recognized ICD-10 codes for those patients. The clinical notes that doctors put into the patient chart, however, sometimes are unclear or don't correlate directly to an ICD-10 code. And that's not a problem with FairPath because we take those clinical notes and our ontology-guided augmented retrieval AI will map those specific clinical terms to specific ICD-10 codes. So for example, we have a clinician for this patient put in the patient's chart that they suffer from shortness of breath. That does have an ICD-10 code match, and it firmly recognizes that ICD-10 code matching to the clinical notes. Now, this is just one example of the ontology-guided augmented retrieval AI technology that's embedded at all facets inside of FairPath. If you have any more questions about FairPath, please visit us at fairpath.ai.